Hi doctors. So now we are going to the second day of Focus 30. Today I came with some important topics, highly important topics like biomedical, waste management, meningitis, CSF analysis, capnography, and Mallampati scoring, and some spotters and some bispectral index. Okay, this is a small session, so please watch it in your free time. So now we'll go to the topic itself. Okay, so day 2 of Focus 30. So, you know what is biomedical waste management? So, every year or alternative year, there is an expected question from this. Okay. Now, we know there is yellow, red, blue, and we have chemical waste and sharp, everything into separate category. So, usually in our hospital, it is there everywhere, and we have still confusion. So, we are going to solve this today. And we have something called, see, the empty table. This empty table, this will be the potential question of your exam. So we will see. So what category yellow waste? Category yellow waste are simply, very simple, infectious and laboratory waste. These are infectious and these are disposed by something called incineration. Incineration is a process. So we can see human body parts, tissues, and lab cultures, specimens, everything will go to the yellow, the infectious laboratory waste and disposal by incineration. What is red? Red is nothing but symbol. Red is nothing but rubber plastic tube. Red, rubber plastic tube. Plastic waste. Red, rubber tube. Everything will go to red. Why? These plastic or rubber tubes can be recycled, returned, and reused. The three are recycle, return, and reuse. Okay, so there are some confusion of some specimen whether it is going to yellow or red. We will clear it. And we have blue. Blue is nothing but broken glass or metallic ortho implants. It will also go to blue, and it is R3, recycle, return, reuse. Okay, and white is nothing but, you may be seeing a white small box. All the needle sharp should go to the white. Okay, this is the basic. Okay, this is the basic of biomedical waste management. So tell me, vacutainers. This is highly what confusing thing. Some people will put in red, some people will put in yellow. Where we have to put vacutainer? Comment. Pacemaker, heart pacemaker, and ampules, glass ampules, except the cytotoxic manufacturers. Urine bag, blood bag, urine bag, blood bag. I'll give you one hint. Urine bag will go to one, blood bag will go to one. And expired drugs and Foley's catheter and vaccines. Where all this will go? Now we will discuss that. Okay. See, vacutainers are going to red. All vacutainers, including if there is sample specimen in there, it is going to red. Pacemakers is going to blue. Pacemakers is going to blue. Ampules and the ampules, those are glass, except the cytotoxic manufacturer is going to blue. In the glass, blue. Okay. Urine bag and blood bag. See, urine bag and blood bag. You can see blood bag is going to yellow, infectious material. Urine bag, which is going to red. So it is recyclable. Okay. Clear? And expired drug is going in yellow. And Foley's catheter, of course, Foley's catheter also going to red. And vaccines are going to yellow. So vaccines are yellow, blood bag is yellow, important. And the vacutainers are going to red. And Foley's catheter is going to red. Okay. And the expired drug is going to yellow. So these are very important, and please see these, and you can see this summary also. Okay, this summary is just enough for you for your NEET PG exam. Yellow, infectious laboratory waste going incineration. Red are nothing but red for rubber, plastic, and tube. Okay, clear? And blue, blue is broken glass or this metallic ortho implants. And white is sharp. The white, it should be usually closed also. There is some box will be there. They'll put the needles after injections and they'll close also. So white is going to sharp metals. Okay, clear? This is very important. Don't make mistake. If you make mistake here, you are going to lose your 4,000, 5,000 rank, because many people will answer and you will be out. Please careful. Biomedical waste management is very important. Now next we will go to some other topic. Okay. So I got a headache, vomiting, there is fever. and this is some projectile vomiting, some features. And after that, when I examined, I had some altered mental status, or then I had some focal neurological deficit, and some other thing is like stiff neck and some photophobia. These three, according to the clinical features, we can tell maybe it is meningitis, encephalitis, or the abscess. So how we can tell? Any focal neurological deficit means it will be abscess, and any stiff neck, photophobia, features of meningitis, and altered mental status, encephalitis. So just briefly, and in this case we have to do some test called CSF analysis, not compulsorily, but according to the clinical need we will do the CSF analysis. CSF analysis is very important. Why? Because in CSF analysis we can differentiation into different. Okay, we can examine the protein level, glucose level, and the gram staining, and cell count, and the appearance. According to this, the diagnosis will change and the treatment will change. So definitely the treatment of TB meningitis is different from bacterial meningitis, which is different from viral meningitis. Correct? So now we will see the normal values, and after that we will see what is bacterial and viral meningitis, and then we'll discuss about some other examples also. Okay, so normally the opening pressure is 7 to 18. Usually pressure we won't see that much. And appearance, the CSF will be clear and colorless. Okay, and proteins you can see 23 to 38 written, and glucose is 2/3 of the serum glucose, and gram stain will be negative, and some ratios are there, and cell counts will be less than 5. Okay, but this is completely changing in bacterial. The pressure is increasing, and their appearance will become turbid, and protein levels are increased and glucose is decreased. Okay, very important, protein levels are increased and glucose is decreased. Okay, now come to viral. Here the CSF is clear and the protein level will be normal, maybe slightly increase or slightly decrease, not that much change, and glucose are normal, and gram stain is negative, and we can see these points. Okay, now you see some other point here. You can see here bacterial meningitis predominantly neutrophils and viral predominantly lymphocytes. Okay, so in bacteria, so the appearance become turbid and the protein is increasing and glucose is decreasing. So what I make a idea or mnemonic is like bacteria which is living in the CSF need some energy. So bacteria eat glucose and excrete protein. So bacteria eat glucose and excrete protein. So in CSF what happens? Glucose level come down, protein level increases. Clear? And here mainly bacterial meningitis polymorphs, neutrophils are the cell count which is increased. But in viral, almost same glucose and similar normal values of glucose and protein, and there is predominantly lymphocytes. Now we'll go to the other parts. So bacterial meningitis, low sugars, high protein, neutrophils are excess, and viral meningitis you can see predominantly lymphocytes. Now you can see something called TB meningitis. In TB there is a appearance called cobweb appearance. It's a cobweb appearance. Okay, cobweb appearance. And here bacterial meningitis polymorph or neutrophils are high. Here it is similar to virus. Lymphocytes are excess. And same. TB bacterium is a bacteria which is eat glucose, excrete protein. That's why decrease in glucose, increase in protein. Clear? And there is some wrong things in here. Don't see whatever I am saying, just see. Okay. In fungal, the color will be usually clear, and lymphocytes will be there, and glucose will be low. Proteins will be either plus or minus, either increase or decrease or normal. Okay. Clear. So just to summarize here, in meningitis, bacteria eat sugar, excrete protein. Symbol virus almost similar. Virus predominantly lymphocytes. Bacteria predominantly polymorph or neutrophils. But in TB meningitis, TB is a bacteria. That's why it eats sugar, excrete protein. Same. But here it is predominantly lymphocytes. Okay. Clear. Okay. There are some other examples also I mentioned. This is very important in pediatrics as well as adult management of meningitis. Okay. Now we are going to some other topic. This is very important topic. Okay. This is very important topic. there will be a direct question will come, and please, if you do small mistake here, you will lose one important question. So this is nothing called capnography, which is very important in anesthesia, in OT setup. Okay, what is capnography? So we'll see. So capnography, you can see a graph here, see the shape. Okay, it's like a Tom hat. This is a shape of our old movie actors is other no hat. That shape is there. So here you can see phase 1, phase 2, phase 3, phase 4. It is touching the baseline. Okay, clear. So here it is touching the baseline, and you can see the shape. Okay, you can see the shape like a hat. Okay, so here there are different phases. This phase 1 is known as exhalation of gases from the dead spaces. So phase 1, and phase 2, gas exhaled from the upper alveoli. So there is a sudden spike. So from the dead space, from the alveoli, and there is a plateau phase. Gas exhaled from the middle and lower alveoli. It's the phase 3, and phase 4, there is a sudden decline. Okay, and inspiratory phase. That's why this capnography, nothing but measurement of end tidal carbon dioxide, and which is measuring at this point. We are going to do measuring this EtCO2 at this point. So here EtCO2 is checked. So carbon dioxide, due to a sudden inspiratory phase, carbon dioxide will come down. That is why this peak is coming down. Just for understanding, I'm telling, I'm not going to in depth. Okay, so this is important, capnography. See, the normal graph is important. Now we are going to study the abnormal graph, which is very important. Question will come at least for sure for every alternate year. This year there may be expected question from this topic. Okay, now see, these are some capnographic images. See, I told it is touching the baseline, but see, there is a slight elevation from the baseline. So there is something called rebreathing or exhausted soda lime. Because of exhausted soda lime, carbon dioxide will be more, it will be remaining there, or because of rebreathing, this graph is slightly elevated and it is uniformly flat and same, but there is an elevation. Clear? Okay, now you can see there is something called a shape of fin, a shark fin, shark fin. This is shark fin appearance because of bronchospasm or COPD. This shark fin appearance is seen in bronchospasm. Okay, so this is a shark fin appearance seen in bronchospasm, very important. And you can see here graph is become, instead of hat shape, it is become a square, and it's big one, hypoventilation, and it's become small, hyperventilation, more ventilation. So the carbon dioxide will be washed out. So the graph came down. And hypo, carbon dioxide increasing, the graph is increasing. So that is why hypoventilation and hyperventilation, you can see the difference. Okay. Now you come to a diagram like this. So you are intubating and you're checking carbon dioxide, but graph came like this. Is nothing but spontaneous breathing started at the end of the OT procedure. That anesthesia is relieved, they will start spontaneous breathing. This graph capnography changed like this. This is a spontaneous breathing, and you can see down. Then another thing, see, there is some oscillations are there. Some small oscillations are there. So this you can tell as cardiogenic oscillation, especially in pediatrics. You can see. Okay. There is some drug called Curare. U. That U will be here. See, there is a notch here. This is known as Curare effect. Okay, notch in phase 3 and the plateau phase. Curare, Curare. So notch U, Curare effect. Okay, that is patient recovering from the effect of muscle relaxant. Curares are, we'll discuss later. Now you can see very important, slowly the carbon dioxide rising up. Okay, this is very important. This is known as malignant hyperthermia, where step ladder format. Okay, step ladder pattern is seen in malignant hyperthermia, and the management of malignant hyperthermia is very important. This is because of some sensitization in calcium receptors and all. We will discuss later. This is important. You may be heard about dantrolene, sodium and all. This is an important topic. Please read about this. Okay, and you can see another graph, incompetent inspiratory valve. So you can see there is a B. This graph is deviating, and you can see graph is like this suddenly. So accidental extubation and sudden disconnect. So graph is terminating here. Okay. Now you can see something leaky sampling line. See, you can see 2 plateau in phase 3. Okay, like that, and you can see something here. This is, I will write like L. This is lung, single lung transplant. Okay, and you can see instead of putting into the lungs, it is putting into the esophagus. It is esophageal intubation, capnography. So this capnography is very important. We have rebreathing, soda lime, which is asking regularly, malignant hypothermia, and its management is important, and Curie effect, which is important. Pediatric oscillations are important. Hyper carbon dioxide washout, graph will come small. Okay, and some accidental extubation, esophageal intubation, these are all very important. And lung, single lung transplantation, this is very important. Okay, very important. So capnography is very important. Now we'll go to the another topic. So another topic also highly important, very simple, but people will make mistakes and they will lose their 4 marks and they'll lose their 1000 to 2000 rank, they'll come down. This is highly important. More than 90% of the student make this correct. If you make mistake or wrong, so your chance of getting good rank will become again problem. Okay, so this is nothing but Mallampati scoring, also important in anesthesia ENT. So you can see Mallampati scoring according to the hanging uvula and thing. So this is classified into 4: grade 1, grade 2, grade 3, grade 4. So grade 1, class 1, so complete visualization of the soft palate. Uvula is hanging very freely. You can see here, uvula is hanging very freely. And class 2, the uvula, the tip of the uvula is not visible. You can see the tip of the uvula is not visible. Okay, tip of the uvula is not visible. This is better image than this. This will go little down. Okay, like that. And class 3, half of the uvula is not visible. There just tip was not visible. Here half of the uvula is not visible. Class 3. And class 4, the soft palate is not visible at all. Only the hard palate is visible. So we have 4 grades of Mallampati scoring. The uvula is freely hanging. The soft palate is easily visible. That is grade 1. And the tip of the uvula is just missing. The tip of the uvula is just missing, like this image. See, that is grade 2. And grade 3 is almost more than half of the uvula is missing. And completely soft palate is not visible. A complete uvula is not visible, is seen in grade 4. So this image is very important. Please refer this image. It is very important for you. Okay, there is a small wrong here, but still it's almost same. Tip will touch there. That is also grade 2. And tip is just missing, grade 2. The tip is completely hanging free. Tip uvula is there. That is grade 1. Uvula more than half is disappeared. Grade 3. Complete uvula not there. A soft palate is not there. Only hard palate is seen. Grade 4, very important, and is very important score for anesthesia, especially in the intubation procedure. Mallampati scoring is a 7-star question. Okay. Now we'll go to the next topic. So bispectral index, maybe some people don't know, but this is an important during anesthesia and surgeries. Bispectral index, you can see this is a spotter. See image. It is very easy. They are checking the electric changes in the brain, EEG, analyzing EEG, and they are coming to some values of bispectral index. And here you can see 60 general anesthesia and 40 deep hypnotic phase. So the range between 40 to 60, they will keep the patient in OT, so that what happens, they can conduct the surgeries. So working principle, analyze the EEG wave pattern form. So bispectral index assess depth of anesthesia. Working principle is assessing the EEG. They will target a value between 40 to 60, which is essential here. And you can see bispectral index value of 100 is equal to awake, respond to normal voice. 80, light moderate sedation, may respond to noxious stimuli. So we have to keep in this range, 40 to 60 for surgeries. Okay, intubation, whatever. Okay, clear. That is bispectral index is a spotter. Now some spotters, see what is this? You are seen multiple times surgery wards. This is something called Roma vac drain. This vacuum, it will take the secretion. So closed wound suction medical device used after surgery to remove the extra blood and fluid. Whatever the blood and fluid collected, it will be, this tip will be there. This tip will be inserted into that wound area, and it, because of we are pressing it and we are keeping it, because of the suction, that material will be collected, we can remove it. Okay, that is also very important. This is known as Roma vac drain, vacuum drain. So vacuum will be there, it will suck the contents, blood, fluid, whatever. Okay. Now we'll go to see another very important. What is this? So you can see here, this is a central line. So central, we have central line and PIC line. Peripherally inserted central catheter is known as PIC, which is very important, highly important spotter, or sometimes as a video based question also it can come. So PIC catheter, okay, PIC catheter. And this is the central line, very important. This is, diagrams are important, just see. And PIC catheter, from the peripheral line it will come and it will go to the main vein, okay, main vein, okay, clear. Now this is the PIC catheter. See the image of PIC catheter. They are putting from here and it is going to the superior vena cava. Okay, clear, clear. So these are the spotters for today. PIC catheter, central line, and Romavac drain, which is very important, and bispectral index. This is spotter, and this is a potential question of NEET PG this year. And Mallampati scoring, very important, 50-50 every alternate year it can come. And capnography, this is nothing but very important, okay. And basics, you have to know basics, please read this also. And bacterial meningitis, viral meningitis, and TB meningitis, just whatever I told, it is enough. Bacteria eat sugar, excrete protein, and bacteria, neutrophils are more, TB, lymphocytes are more, okay, like that symbol, okay, just see that. And biomedical waste management, very important, vacutainers, pacemaker, and this urine bag, blood bag, and these things are important. Foley's catheter and vaccines, where they'll put, this is a very important area. And just see this also, yellow incineration, infectious laboratory, red is plastic rubber tube, recycle, return and reuse, and blue broken glass or some metallic ortho implant, and white is like sharp, okay, clear. This is also very important. So our focus 30 ka second day is over. These are very highly important. Tomorrow I will come with a little more elaborate and highly important topic. Please subscribe, be in touch. Tomorrow we'll see. And today is, when I am finishing the video, it's 9:30. I will be posting around 10 o'clock every day, 9:30 to 10 I want to post. Please be this time. Whenever you are feeling exhausted, tired, just take my video, watch the video, and please, these are very important, don't miss it. And tomorrow we'll come with another video. Thank you.